a naturopathic doctor. I practice in the East Bay. And I'm here to introduce Dr. Adiel Tel-Oren, who I've had the pleasure of working with for about a year now. And I have to say, I'm going to read his CV, but just to give you a very authentic experience, Dr. T, as he's affectionately known by, is an incredible person as a whole. He's a humanitarian, he's a brilliant inventor, and also a genuinely nice person. We all need that in our life. So just to give you some professional credentials about Dr. T, he's an MD that's trained in Europe and in the United States. He's a doctor in chiropractic and a licensed nutritionist. He's also board certified in functional medicine, clinical nutrition, disability analysis, and oxidation and chelation therapy. And especially in today's very toxic environment, a person like this is important to have as a resource for us. He's also a professor and certified clinical nutritionist with the International and American Association of Clinical Nutritionists. He's also President Emeritus, Dean of Medical Sciences, and Professor of Functional and Nutritional Medicine at the University of Natural Medicine in San Jose, New Mexico. He lectures and travels internationally to doctors, health practitioners, and to the public, and trains other practitioners on natural functional medicine. And I'll have to add that functional medicine is the way that medicine is going in the future. I myself, being a naturopath, use a combination between traditional Western and Eastern therapies. And I'll say that you get the best result when you really combine the two of those together. He's a sought-after lecturer on skin and functional medicine and how to remove skin lesions and treatments naturally. He's also an expert in skin health and longevity and connecting the objective measurable skin parameters, which we'll see today, that lead to and really distinguish how our body is aging. He also has a restaurant, a raw food restaurant in Minneapolis, which is fantastic, gluten-free, non-GMO, and this is the way that, again, our diet needs to be moving in that direction, again, because of our toxic environment. On top of that, Dr. T organizes biannual trips to Nepal because his foundation, the Everest Learning Academy, really steps up and funds the opportunity for the children in Nepal to have adequate education and adequate nutrition. Gosh, this is so much. He also runs the Israeli Center for Functional Medicine, as well as the Ecopolitan Eco-Health Community. The Everest Learning Academy as a whole is a network of schools, community centers, orphanages, and child care centers that educate, nurture, and protect 10,000 disadvantaged children in rural Nepal from child trafficking, prostitution, and slavery. That is amazing. And the work that he does here funds this nonprofit abroad. So please welcome Dr. T as he describes the science of anti-aging.
Am I okay here?
Yep.
Everybody hears me fine?
Yes.
Everybody wants to hear me fine?
Yes.
Everybody cares about skin because... 1, 2, 1, 2. I think that it's just not stable. Life is not stable. Everybody cares about skin because everybody possesses a lot of it. We have 2 square meters of skin on our body, which makes it the largest organ and also the biggest barrier that protects us from the environment. People don't realize that the barrier is the most important function of the skin, as barriers throughout our entire body protect us from numerous diseases and degeneration and aging. We all have barriers in the gut, in the lungs, in the brain, next to every blood vessel, and those barriers allow the inside of each environment to be different from the environment outside of it, including our cells, which are different inside from the extracellular matrix that is surrounding the cells. This distinction between the inside and the outside is what keeps us alive as human beings. And anytime we cause even the slightest offense to that barrier, our life is no longer the same, because we start making steps towards degeneration, aging, and death. The skin, therefore, has numerous functions in order to create this barrier. For example, the skin has its natural pH, which is between 3 and 5, fairly acidic. That low pH allows only certain types of bacteria to survive and prevents pathogenic microbes from taking hold. The skin has the right types of oils, fats on top of it, which protect us from also different types of microbes, because some of those fats are natural antibiotics. We manufacture sebum, the oil from the sebaceous gland, also to protect us from losing water, because if we lose moisture from the skin, we end up dehydrated and the immune system of the skin cannot function anymore. Therefore, the skin must be almost sealed shut. It also must be very dry at the surface, because the drier it is, and the more oily, and there's no water almost at all, it will not allow microbes to grow within it. That's why the skin has various layers with different functions. The function on the surface is very different from the function of the inside of the skin, which is yet very different from the function of the dermis, the lower part, which provides elasticity. So we speak about the skin for our purposes in terms of 3 different layers. The layer of the stratus corneum, which is the outer layer that is supposed to be totally dry and oily and fatty. That's the barrier that does not allow any water to escape. Then we have the second layer, which is the living epidermis, the one that contains lots of water and lots of immune components, and that holds onto the moisture that we need for the skin to avoid becoming totally dry and flaccid. And then we have the deeper layer, which confers elasticity from the dermis, where we put the collagen and elastin together. When we lose all 3, we lose our appearance of the skin, and the skin starts aging dramatically. But some people, because of their lifestyle, because of their behavior, would have only one type of a problem. Only their elasticity will be damaged, but they will have very good function of the stratus corneum on the surface. And some people will just lose the water in their deep epidermis, the living epidermis, but they will have very good elasticity. Each one of us is different because of our lifestyle choices, our diet, and our behaviors. And today we will talk about some of those behaviors that can make different types of your skin suffer in different ways, which will tell us what you need to do to improve your health by changing your lifestyle in a direction that would give each and every one of those 3 main layers of the skin the advantage that it needs to move towards rejuvenation. Why is it important? Because the skin is not the only barrier in your body. What happens to your skin also happens everywhere else. And people don't realize that the skin gives us an accurate picture of your entire body's health, including your brain, your digestive system, your immune system, and every other system in your body. So it's not just about being skin deep. It's not just superficiality anymore. Not only we will describe some of those parameters, we will also demonstrate, because I will ask some volunteers, those of you who don't mind a little pain, to do some diagnosis on. So if you volunteer, we will know how your epidermis functions, the dead epidermis, meaning the outer layer, the living epidermis, the actual dermis, and if you don't suffer so much, we might even repeat it. And then we will compare it with somebody else. So that will give a chance of suffering for more than one person. Actually, I'm joking, it doesn't hurt a bit. You don't even feel it. And you can do it in just a few seconds per person. And today we'll just be doing it as an introduction to skin science, because the new science of the skin is something that practitioners of skin have no clue about. It's just recent, just the last few years. It's not taught in medical schools. It's not taught in naturopathic school, in chiropractic school, in osteopathic school. It's only available in the research publication. There's a book here called The Innate Immune System of the Skin and Oral Mucosa. That book is not read by anybody who claims to be sane. It's only read by people who are into deep research, people who study the skin and nothing else. And they might dedicate years to write one chapter in this book. So it's never becoming available to the general practitioner population. Until this information becomes knowledge, common knowledge among practitioners, among clinicians, could take 20 more years. And therefore they will not give you the right advice with regards to maintaining your health and your skin's health. That advice you're going to start hearing about today. But we will have to get into greater depth at a different time, when we will hold an 8-hour seminar of skin science. 8 hours for people who really are interested in learning how to diagnose people with those devices that I'll show you, that I'll introduce to you for the first time. Devices that have until now been only available to research scientists in big universities, where they had such a crazy mad scientist who's interested just in studying the skin. Usually PhD scientists, that's all they do, and they have absolutely no connection with clinicians. So the clinicians don't know that stuff. Therefore it doesn't permeate the population. And people don't benefit from that knowledge until now. Once people come and get that 8-hour seminar, they will be able to disseminate the information and make their clients and their patients enjoy those protocols that science has proven will improve the rejuvenation, the youthfulness, the appearance of their skin, and their anti-aging efforts for the entire body. So that is one of the books and one of the sources of information that I had to read to give you that material, that interesting information that is usually lacking. Now, generally speaking, people don't pay attention to the skin until something is wrong. And if you're young and you think that something is wrong, it will be generally because of some kind of a blemish or a growth or an inflammatory condition or acne, pustules, scars, or it might be affecting you because of discoloration or roughness. Something might appear suddenly to be different, and because that's what everybody can see, you might feel bad about it. So one of the worst things that people worry about is skin lesions, like skin cancer. And that is basically the only interaction that is meaningful between people and their skin doctors. They like to go to the skin doctor to make sure they don't have advancing cancer. They want it to be detected sometime before it gets too late. Unfortunately, usually it does get detected too late, and I don't want to make this a skin lesion seminar. This lecture is not about skin lesions. But there is a connection between skin lesions and skin aging. And that's why I have to mention a little bit about skin lesion. If you go on YouTube, you would find some lectures that I've given about skin lesions available for free online, and therefore I don't have to get into that in any great depth right now. But melanoma is one thing that people are worried about. And generally speaking, if you can stop melanoma in the earliest phase when it's still not a melanoma, that would be common sense. But usually when you go to skin doctors, you wait until it develops into something suspicious that would then create the alarm that leads to the biopsy. And the biopsy carries risk, a risk of spread of cancer. If you cut into an existing cancer, you might spread it. This is well known in the scientific literature. That is only going to happen if you wait long enough, and the problem is that in every one of these pictures of melanoma, you see one little dark spot somewhere. In this case, you can see a little bit of a dark spot right here. In this one, you see the dark spot right there. And each one of those dark spots basically were there, but were ignored until they started growing all around them, those pigmented points that suddenly created that panic state. But if you had those tiny dots beforehand, those dark dots on your belly, on your back, on your pelvis, those dots are the first sign that they are activities of your melanin-producing cells. And if you eliminated those melanin-producing cells at that point, if you eliminated those tiny dots, you wouldn't get to the point where you develop the whole melanoma. It's that easy. But nobody wants to volunteer to have 30 surgeries, each one for every little dot that they have. So nobody does it, they just keep waiting until it becomes a melanoma, and then it's a life and death situation. There are ways, and there is a method, and the doctor that I have trained, like Dr. Vera and others, know about this method to easily eliminate little tiny dots, dark dots, before they get to the next step, before they become a risk. So then you can remove even 100 of them. When they're still not dangerous, when they're still not malignant, just get rid of them, and then none of them will ever become a cancer, so you can be 100% melanoma free. But what about carcinoma? Carcinoma is something that is not damaging in terms of life and death, but it's obviously disfiguring. Nobody likes to have carcinomas, and even they are extremely superficial. When you catch them even in a fairly advanced stage, they stay down to the basal layer. That's what they call basal cell carcinoma. Very easy to treat them, and this is the after. After the treatment, you don't even see that there was anything there, or barely anything there. Look again, before and after. Very simple, without surgery, without pain. Even after it's been diagnosed by a skin doctor, there's no reason to do severe surgeries. And track record has been shown to eradicate those cancers completely and permanently with no surgery and without pain, without injections. Too simple. You can remove other lesions that are birthmarks, which can be predisposed to cancer. There are other types of carcinoma that you could see how easy it is to heal them. And in most of those cases, people have done the surgery before and the cancer came back, which often happens after you do a surgery for skin cancer, is a very high rate of recurrence, which does not happen when you treat it in a more physiologically logical way, not going too deep, but going more to the surface, which is where the skin cancer derives. And some people have a lot of cancer, farmers who have had multiple surgeries, and they have surgeries every 3 months on their skin. In one sitting, they can take care of so many cancerous lesions or precancerous lesions when they finally decide they had enough of the surgeries. If you go to the booth or if you look up online, you'll see lectures about how to actually do it. But it's very simple, and you see the before and the after. Now, here's a cancer that was diagnosed, and the patient refused to have a surgery that she was told was going to completely distort her face with a huge scar. So this is before the treatment, this is immediately after the treatment, and here is later on. You see that very little here is left of this very deep cancerous lesion that was already diagnosed and that she refused to have a surgery for because she was told the scar would go almost from her eye to her lip. There are other types of cancer lesions that can easily be eliminated, and some people even use over-the-counter products that they buy, and this is one such person who, as a result of using an over-the-counter product or something that he bought online for self-treatment, lost his nose as a result. And even though he lost his nose, he still had cancer at the edge. So he still needed to be treated for the cancer. He lost his nose for nothing. But that's the problem. In the holistic movement, sometimes people will convince you to do all kinds of things. And you will believe it because somebody talks holistically. So you think, well, he's in my church. He goes to my church, my synagogue. He's like me. He's holistic. I'll believe everything he says. Well, you have to be cautious and discerning with holistic medicine, just like you are in allopathic medicine, meaning the orthodox medicine. You have to always have your eyes open and expect results that would be immediate and conclusive. And you can also look at other types of lesions on the tongue and then the lips, which can easily be removed before and after. Before and after. You see the lesion here that's no longer here. All of those lesions are not important to today's discussion, except they have something in common. All those lesions developed because there was pathology going on. Your skin was suffering some type of pathology. And every type of pathology could affect different structures in your skin, which will therefore result in different parts of your skin showing problems. If it's affecting the melanin-producing cell, you'll have dark spots. If it's affecting the non-melanocytic epithelial cells, you may have skin color spots. If you have a rapid replication as a result of some environmental pollutant or toxin or trauma or infection, you will have growth. And the growth can be compounded or simple. It depends on what part of the skin is affected. That's not the important thing. What's really important is what was the pathology that allowed the skin to become susceptible. What makes us lose our resistance? The skin is the largest immune organ in the body. Because it protects us from the environment, it has numerous immune components. The innate immune system is extremely complex in the skin to warn us about incoming pollutants and incoming microbes, incoming allergens, incoming antigens. And only when something goes wrong with this resistance, only then various skin lesions can happen. And indeed, studies have shown that when people develop leathered skin, and here you have a nice picture of leathered skin, when the skin becomes totally tanned, you know the tanning in the industry? I'm not talking about sun tanning industry or those tanning salons. I'm talking about making leather. The tanning industry creates leather from skin by exposing it to all type of insults, severe heat, severe inflammatory compounds, free radicals, and by doing that, we create leather out of skin. So this lady in the picture has created leather out of her skin over many years of excessive exposure. That skin that she has is so damaged that she is now susceptible to all type of skin lesions, not just skin cancers. Every lesion, every mole, every hemangioma, every keratosis, every hormonal lesion, every dietary toxic lesion, neurological lesion, all those different skin lesions that could happen from any reason will be much more common in skin that has been leathered, that has been aged. And that's the connection that we want to focus on today. We want to focus on what it takes to prevent our skin from being damaged. It's what we don't do that counts more than what we do. You can eat the healthiest food in the world, and that will be fabulous for your skin. But if you also do certain things that damage your skin, you will create an aged appearance, and you will also be probably damaging other parts of your body, causing an overall aging effect, when in fact there's no such thing as aging. There's only damage. Remember age, damage? Damage is what we accumulate. Aging does not get accumulated. Aging is just a number. It's just time. Time has passed. But during passage of time, we can certainly accumulate damage. And therefore, we have to talk about the damage that we are doing to ourselves more than about the age, and stop blaming everything on your age. It has nothing to do with that. I've seen people with extremely youthful skin at age 65 and people at age 28 who already have the markers of somebody who's 50 or 70. And it's reversible because your skin replicates within 28 days. One of our barrier methods is to slough off. Every time you slough off skin, you are practicing the innate immunity. You're eliminating bad things. So we want to slough off, and within 28 days, we can definitely make our skin a lot younger and a lot healthier. At that point, we would also want to make the inside of our body healthier and younger. Here is the kit. This is the world's prototype, the first one in the world, a prototype of testing the skin to find out scientifically the parameters of all three environments of the skin we have discussed, those three layers. Each one is completely different technology. Each one was until now just available in university research facilities, and now they are for the first time available to clinicians to learn how to use them so that they can give people science-based protocols for anti-aging based on a study that is non-invasive. You no longer need to give your own tissue for biopsy. You can give a piece of skin for biopsy, but since it changes every month, you wouldn't want to give a piece of your skin every month, would you? You can also give a little piece of your brain for biopsy, but what type of brain will that be if you want to actually give a piece of it so easily? We don't want to give too many of our internal organs for biopsy, but with these devices we can measure and extrapolate what's wrong with your skin, will reveal what's wrong elsewhere in your body, as I will introduce to you today. So what I'd like is to have two volunteers. Would you like to be one of them? Yes. Please come with your chair right here, with your chair. And somebody is there with, you have a nice color. You can come. Yeah. Nice color is always good for people's eyes. Bring your chair. and sit right here in front of me, in front of the public. Thank you. No, keep your shirt on. Okay, if you want to take your shirt off, but I'm not going to use it. Okay, I mean, some people are exhibitionists at heart. So, we have two people representing male, female, different colors, different skin type, which makes it interesting. And we're going to start by measuring the outer layer, which is the stratus corneum, the dead, so-called dead epidermis, which is the most important measurement we can do because it represents the barrier which protects us from the outside environment, which keeps itself always dry and oily, dry from water and oily, where both our sebaceous glands and the epithelial cells of the epidermis are manufacturing different types of oils, which are crucial. Those oils are known antibiotic, and we manufacture them specifically for that purpose. We have the right enzymes in our skin that do the job in building those antibiotics in the skin, which are fatty and oily in nature. And that's why we need to respect the oil of our skin. Plus, it prevents the loss of water. So it keeps the moisture inside the skin where we want it. And that measurement is called transepidermal water loss. Transepidermal water loss was very difficult to test. It was requiring a whole room with controlled temperature and moisture. Now we have the whole room inside a little hole. And that hole is going to be sealed shut against the person's skin. And it will measure in grams per square meter hour how much water vapor is allowed to escape through the stratus corneum. If too much is escaping, more than 4 to 6%, for example, that's typically acceptable level. If you lose more than 4 to 6%, that means that you are dehydrating your skin rapidly, and there is no amount of water that you would drink to replenish it. Because most of the water you drink does not get into that area. It gets into your blood and immediately into your urine through the kidneys. For this, you need to retain the water in the living epidermis and prevent the transepidermal water loss, which is what this measures. So we're going to measure each one of their forearms. So please lift up your shirt. And all we want is the middle of the forearm at the area that does not have hair, so that we have good, tight seal. You don't have to make a fist. We're not taking blood out. Not just yet. Okay, so we're going to do it as soon as it tells us that it's ready. And it's ready. And now it's counting for 10 seconds of accumulating the vapor that comes out of the skin. And the amount here is so high that he's losing a lot of water. In fact, it's so high that I suspect that something is wrong with the battery. Because this is an amount that he should not be alive. I've had people who had 9, 10, 11 grams per meter squared per hour, but his is like 39. So it's not possible. I've seen 14 or 16. He doesn't look like he's been leathered. So in all likelihood, it is just something, the battery here needs to be replaced, and I apologize for that. But let's just assume for a second that he has, it says low battery. Let's assume for a second, just for educational purposes, that his number, how disappointing, isn't it? that his number was 9 instead of 4 or 5 or 6. That means that he would have done something to harm himself today, and we need to tell him what he did that was wrong. Let me do it again with you. Maybe you'd stimulate a healthy battery level. You know, when the battery goes down, it can be sometimes good, sometimes bad. So let's hope that this will be a valid number. And that's a valid number, 6.6. So she has slightly elevated transepidermal water loss. And let's ask her, what did you do today to protect your skin?
I did put on some moisturizer this morning, and then when I got here, I tried some topical that they had on one of the tables, and I always drink lots of water.
Okay, so in her mind, she did a lot of good things for her skin by putting lotion or moisturizer and drinking lots of water. Did you take a shower today too?
Yes.
Is that not a good thing for the skin?
Yeah.
Oh yeah, she says, shower will be good for my skin. So let me tell you something. In nature, there are no showers. Definitely not hot showers. And the water, if you did jump into a lake or a river, there will be no chlorine, no fluoride, no bromine, no toxins. The water would not be hot, and you would not be using soap. As soon as you use soap, even if it's those natural alkaline soaps, you are destroying the lipid layer of your skin, which is crucial for also the pH of the skin. And many times when you use soap on your skin and the pH is no longer 3 to 5, it went up to 7 or 8, especially with those alkaline soaps. Anybody know what I'm talking about, alkaline soaps? They actually convert your pH so that the bacteria no longer works, and the enzyme that requires that very narrow pH range, an enzyme called ceramidase, cannot do its job, and you are failing to make those antimicrobial oils on your skin. As a result, your skin is becoming susceptible to infection, and all those pathogenic bacteria can start growing on your skin instead of the healthy bacteria. And recent studies have shown hundreds of important types of probiotics on your skin, which are just as important, if not even more important, than the probiotics in your gut. Yet you are totally dismissing them. Whenever you take a shower and scrub your skin with soap, you destroy that natural oil and you start increasing your transepidermal water loss. Because now you're not sealing shut, you lost the pH, and you have an inappropriate bacterial level that are potentially risky, pathogenic, infectious, and toxic. So you are actually destroying the immune system of the skin by taking a shower, even more than by going in the sun. Being in the sun for a long period of time also destroys the immune system of the skin. But for a short period of time, we actually stimulate the immune system of the skin, and we manufacture vitamin D, which is a natural anti-inflammatory, antioxidant, and antimicrobial agent that we make together with all those other molecules that are perfectly comfortable in the oil of our skin. Molecules that are called defensins and others. So, questions at the end. Please, don't interrupt with questions, otherwise there will be chaos. Everybody loves their showers. People just can't stand it when I tell them that, you know, if you really are hygiene-oriented, if you've been brainwashed to think that when you get into a clean set of sheets, you need to be immediately after a shower, actually after a shower you are far dirtier, you have far more pathological bacteria on your skin than before the shower. And people don't like to hear that, because we were told that cleanliness is godliness. And it's unfortunate. Somebody is making a lot of money telling us that stuff, selling us all those soaps and shampoos and conditioners, things that are only drying our skin, eliminating natural oil. And then on the other side, the flip side, we try to compensate by using those lotions and those moisturizers. Now, most of those lotions, including natural oil that you put on your skin, like coconut oil. People, raise your hand if you put coconut oil in your skin. A lot of you, because you are educated and you're holistic. And you've been told that this is good because if you can eat it, you can put it inside on top of your skin. And you know, coconut oil does wonders when you eat it. It's designed to be eaten. But when you put it on your skin, you are diluting all of those natural oils, you're changing the pH. Again, you destroy ceramidase, you lose your antimicrobial function, and you end up with all those pathogenic microbes that stimulate inflammation and destroy your stratum corneum. And you start having transepidermal water loss, and you lose more and more of it. So you have to be very careful about what you're told and about what you do. Instead of following nature, where all the animals are never going into a hot shower, never using soap, somehow they're doing fine. Miraculously, they don't get infected in the skin like we do. And they don't have the inflammatory skin disease. I mean, they don't have the skin cancer because we are destroying our own integrity of the skin. It becomes easier after we have caused inflammation and degraded or suppressed the immune system of the skin. We should not be so surprised that suddenly we have susceptibility to other types of skin disorders like skin lesions and cancers and so on. So the first thing to do is to reduce your shower intake dramatically. And you know, don't exceed once a week. If you absolutely have to shower twice a week, never shower longer than you can hold your breath. Let the water wash through, and that's it. And if you feel stinky, you can use natural oily soap, you know, soap that are made from coconut oil or olive oil, only on the holy stinky triangle. And make sure that your diet improves enough, because who are the stinkiest among us? Those who eat the most amount of protein. Protein is dirty metabolism. Therefore, everybody from Super Size Me to all those other movies, when they eat a lot of protein, they start having toxic waste. Lots of ammonia and other things that come out that are basically fertile ground for microbes to ferment and to cause odoriferousness. Therefore, if you eat better and focus mostly on plant-based and lower your caloric intake from proteins, then you will be a lot less stinky. Whereas if you eat more fats and carbs, especially natural, wholesome, complex carbs, including the fiber, then even if some of you don't like fat, fat still burns clean. Fat is a nice source of calories when you need those calories. And it's a nice source of all those fat-soluble nutrients. And we need fats for many functions, including the fats of the skin. I see many times people who go on a low-fat diet, under 10% of the calories, and the skin becomes dry because they can't make all those sphingolipids, all those ceramides, all those short and medium chain triglycerides and free fatty acids that they need on the skin surface. They can't make it. And they need cholesterol for skin health. One of the oily components of the skin is cholesterol in high amounts. So if you don't have enough cholesterol, you're going to start having your skin shrink and age. And the same will happen to your brain. Because you need fat to prevent that. And that's one reason why some studies show that people who go on extremely low-fat diet, although they will have lower cardiovascular risk, which is established, have increased risk for brain degeneration. We need more fat. but it has to be healthy, stable, plant-based fat. Healthy, stable, plant-based fat. So these are important features of a healthy skin, and when you use fat and carbs that are healthy and wholesome, you will not have a stinky, odoriferous body, and you can then raise your hand because you're sure, even after a week of no showering, I'm willing now to go line by line, and you're going to sniff me and tell me how offensive I am to you. I'm willing to take the heat because I stay away from excessive amount of protein. I will tell you in a minute why. When we measure the second aspect of the skin, which is the deeper epidermis, the deeper epidermis that contains a lot of moisture, that moisture does not come from just water that you drink. It's moisture that is held in place by the specific mucilaginous proteins that are built by your own body to take residence in the deeper epidermis in order to hold the water within that part of the body. Some people say, well, I need to eat more protein so that I will have more protein to hold on to the water. But no, the protein you eat will have to be disassembled anyway. And then you have to reassemble inside your body the appropriate things. In nature, we would be eating lots of seaweeds containing sulfated mucopolysaccharides, which are containing some elements that help hold on to water. Why is that? Because in nature, if you eat those seaweeds, you feel how mucilaginous they are. They're kind of slimy. That sliminess means that they hold onto the water. They need that because they live in a very salty environment. When you are in a very salty environment, you are at risk of losing all your water outside because of osmotic gradient. To avoid that osmotic gradient, you have to do something. You have to spend energy on building molecules that will proactively hold on to the water and prevent the water from being lost into your salty environment. That's what the plants are doing, and that's what we are doing. Our naked skin indicates that we came from a very watery environment, like elephants and rhinos and hippos. They all have naked skin with hair, but you could see the skin like humans do. And that's an indicator. There are many other indicators that are part of another lecture that shows us that we have a big part of our history is in watery environment, at least semi-aquatic environment. And that environment was mostly in salty water. So we had to develop our own salt-sparing and salt-acquiring traits to keep ourselves healthy in that environment. That's why we have salty tears, salty sweat. And that's why we always crave the salt that would come from much of the food that we would have eaten. But that contains a lot of sulfated mucopolysaccharides, which also are a source of sulfur. That's why I recommend eating seaweed if you can find clean sources, or at least eat the salt that contain high amount of sulfur. There are some salts that are coming from the Himalayas that are specifically rich in sulfur. That's what you should be looking for to continuously replenish your skin and your hair and your nails with the necessary sulfur for building up the ability to hold on to water. So let's measure how much water or moisture there is in these people's epidermis. This is a completely different unit, different electronics, and it measures the tissue water percentage at 0.5 to 1.5 millimeters below the skin surface. So it's a deep epidermis where we need to have moisture. With little kids, we could have 70%. As we grow more and more damaged, right? As we grow more and more damaged, then the numbers gradually diminish, and we see people in their 50s and 60s with only 30% moisture, or 30 to 40. So basically, the skin dehydrated, and the immune system will not function. and the enzymes of the skin will not function, and the energy to protect the immune system will not be there, and the cellular protection will not be there. So that is a crucial part of our health. If we don't have mucilaginous capability of holding water in the tissues of the skin, we cannot hold the water elsewhere in our body also. So our liver and our kidney, our brain, our critical organs are also going to be losing water because of insufficient ability to hold on to the water. And then, of course, when you lose more water through the barrier, the dead part of the epidermis, the problem will be even worse. It will be accelerated because you lose it too fast and you don't hold to it anyway. And of course, the barrier is crucial, especially for the brain, where we have the blood-brain barrier, and for the gut, where we worry about leaky gut syndrome. There are a lot of commonalities between the skin lipid structures and the lipid structures elsewhere in your body, just like we have commonalities between the water-holding components of the skin and the water-holding components of the body. So let's hope that you are not going to jinx this machine.
How's the battery, Ellen?
The batteries here were perfectly fine until you started talking. Okay, ready?
What is the normal numbers?
The normal number is depending on your age and depending on your health. So there is no normal, there is ideal. Ideal will be about 70. But as people age, because of the damage, they have less and less. His level of water in the skin is not so bad. It's 60%. 60% moisture. So he's doing some things correctly, at least a few. He's not only destroying batteries or eating battery acid. And let's see what the number is for you, lady. We hope that you have at least as good a number as his.
I'm 90, so.
We'll see about that. 42%. So obviously you are losing too much moisture.
So
all those moisturizers, all those lotions are basically, instead of doing their job, they make you depend on an external source which changes the structure and function of the skin. And now you become dependent on those external products that those companies want you to keep buying. And indeed, when you use them, you start having increased transepidermal water loss. Hers was already going up. Also, it causes the damage to the inner structures of the epidermis, and she cannot hold on to her water as well as she should, so it's starting to suffer, to being damaged. And so we need to make some changes in your nutrition. Now, I did a little study on myself. I didn't have much time for it, but in a few days, I ate a lot more protein. Just because I was trying to see the connection, at least in me, one person. I know it's not much of a scientific study. We will do a bigger study very soon. But I wanted to know if eating a lot of protein that was vegan, because I would never touch animal protein, but I wanted to touch protein. And I know about all those vegan bodybuilders and all those people who are worshipping protein because they've been brainwashed to love protein, to think it's really crucial to have enough. And of course, if you listen to any of my lectures, you would know how unscientific that concept is and how damaging protein can be when you have it in levels higher than 10% of your caloric intake. Therefore, you should never go for all those protein powders and protein bars, even if they say vegan on them. They're completely produced, completely manufactured, completely concentrated, and you get too much. But I knew all that, but I still decided to test myself. So for 1 week almost, I ate a lot of those protein powders from some of those well-reputable vegan protein companies. And as a result, there was a steady increase in the damage to my protein holding molecules in the skin, and the skin moisture went down. Now, I'm just one person, and when I stopped, it started going up again. Last time I tested myself, I was about 66.5 or 66.2% moisture in my skin. And I'm older than you, I think. Maybe not. But, you know, everybody should be able to go to 65, 66%, even if you are 60, even if you're 65. And if you went down to 60 or 55% moisture, that's not too bad. But you have to avoid then too much water loss in your epidermis so that you can keep that water in the deeper epidermis. So for that you have to have the appropriate lipids, which means, again, reducing the shower and avoiding the soap. And eating healthier so you don't need as much soap even in your holy area, your holy stinky area. So that's about the moisture. Now people say, I need to hydrate myself, drink all that water in order to bring more water to my low moisture skin. Think again. I've seen people who drink tons of water because they are so compliant with what they have been told. And I don't understand sometimes why it is the holistic people who already don't believe the establishment, why are they suddenly believing the establishment about the water intake? In nature, you wouldn't be drinking that much water. You would be eating food. And the food is not your source of direct water intake. It's not your fruits and vegetables that give you the water. It's the carbs and the fats that give you the water. Whenever you metabolize energy, you oxidize those fats and carbs, hopefully not too much of the protein. And that clean burning fat and carbs results in hydrogens that are used in the production of energy-rich molecules called ATP. Those hydrogens then have to be somehow eliminated from the system, and they bind the oxygen that you inhale, forming water inside your cells. So anytime you eat calories, you are making water inside your cells. And that's your best source of water, your own, what you made. Only if you lose a lot of water through exercise, sweating, going into the sauna and so on, only then, when you're not eating, you may need to drink some water to replenish what you've lost in large quantity. But as long as you are not losing too much, and as long as you're eating food, you will never go thirsty. That's why the last time I drank a glass of water was about a week ago. I almost never drink water. No more than a glass of water per week. That's all I need. And I still have moisture content in my epidermis far higher than most people who are much older than me. Sorry, much younger than me. You know what I mean. Much younger than me. So that is about that. I'm not telling you to get dehydrated, but also if you lower your protein intake, you will not need as much water in your body to be drunk. So eat lower protein intake, and you'll be able to drink a lot less, and you'll put less stress on your kidneys. Plus, you will be lowering the aldosterone imbalance, the hormone that are affecting the kidney and how it spares minerals, and it will also give your adrenals more power to handle stress. A lot of people that I test have low sodium and low chloride in their blood, partially because they don't have enough salt, but partially because they drink too much water. And as soon as they lower their water intake gradually and slowly, after they join WA, Water Anonymous, because it's highly addictive, slowly they lowered their water intake, and then they were fine. They were feeling much better. And the sodium and chloride level slightly increased. Now let's go to the elasticity. The elastic part of your skin is your dermis. And that is what makes your skin feel leathered and lose its pressure against you. We have a special machine that can test for that. It's called the Elasti Meter, and it measures the elasticity of the skin in newtons per meter. Completely different technology yet from what we had before. What we're going to measure now is elasticity, which the higher the number, the better it is. You can have 150 if you're a baby, or 170, and you can have just 50 or 40 or 30 if you are excessively damaged. Let's see what happens here.
New my neck? Huh?
Same place.
New battery, right?
No. Now try to not be a wise guy. Okay, not bad. He has fairly good skin, except for that transepidermal motor loss we don't know. But he has 94 newtons per meter. That's fairly good amount of elasticity.
Yeah.
But you could easily get to 120 at your age group.
What should it be for my age?
Well, I don't know your age, but
72.
it's fairly good. Although, like I said, you can easily bring it to 120.
You can use my age, I'm 63.
51 newtons per meter. So you are doing too much. You are fussing too much about your skin, and that damages it. The least you do for your skin, the more natural you are. And this guy is probably more natural. I don't know how often he takes shower and how much. But
Once a month.
well, he doesn't use too many lotions and creams and other things like that. So probably he's doing what he needs to. And we have a whole discussion in our 8-hour seminar about how to improve the elasticity of the skin by improving the circulation, by improving the nutrients that you take in through food, and by avoiding all the nutrients that damage your skin and your blood vessels and that create leathered appearance of the skin, especially the AGEs, which occur in your food when you burn it, or when you brown it, or when you expose it to high heat above 248 degrees Fahrenheit. And when you cook it for too long, you are actually causing the formation of those advanced glycosylation or glycation end products, which cause inflammation in your body and in your skin. So you have to avoid extremely roasted and broiled and barbecued and fried and otherwise excessively heated foods. Plus, you have to avoid all the high fructose food. High fructose causes a lot of this AGE formation, which also creates loss of elasticity in the skin. So all those issues we will cover in greater detail in our 8-hour full-day certification seminar in skin health and science and skin longevity and rejuvenation and overall anti-aging and healthy aging. That seminar will be held in various parts around the country in the next year or two, and I will be conducting those seminars together with a PhD scientist who edited this book that I just showed you. She's one of the world's foremost skin scientists, PhD, and she'll be doing those seminars with me, so you'll get all the most up-to-date scientific information about skin, and you'll be able to help people not only improve their health and longevity, but also improve their diets to become more plant-based, less proteinaceous, to eat food that are more natural, more wholesome, less affected by processing and excessive cooking and excessive heat and other forms of processing. You would learn exactly what the protocols are with regard to the appropriate supplementations that protect you from AGEs and other supplements that will support the overall health and longevity of your skin and your entire body, so that your skin will be a reflection of the vital and productive and happy person that is hiding inside that skin. I hope that you will all join us to learn, and that you learn a little bit of the skin science and how we need to treat our body and our skin to be healthy, not just as vegetarian or vegans or omnivores, but as a mammal that is supposed to be going back to its natural habitat, protecting the ecology and the ecosystem within our body and around it in a way that will allow our health to thrive, as science has clearly shown. Thank you much, and if you have any questions, I will take them now. We have no time for questions. It's okay.